As I tell my students, people are divided into two categories: those who have hemorrhoids and those who will have one.
Let's just say, of course, I didn't dream of becoming a proctologist in my childhood.
I was expecting this question. It's probably the most pressing one.
What myths do you face?
Probably the biggest myth is that hemorrhoids turn into cancer. That never happens. Hemorrhoids don't turn into cancer. The only thing is that bleeding can occur both with hemorrhoids and with tumors of the rectum. Some apply plantain leaves, and there's a herb called lady's thumb. It really is an anti-hemorrhoid herb. Then there was a folk remedy that you needed to eat a glass of cornel seeds. I first heard of such an interesting treatment for hemorrhoids when a patient confessed that he smoked his hemorrhoidal nodes over a bucket using cow's hoof. You had to ignite hoof in the bucket so it smoked, and you had to... I remember I was shocked. It was such an unconventional folk method. But eventually, he ended up seeing a specialist. Patients do all sorts of things. They insert potato candles and apply cabbage leaves. There were even patients who steamed garlic, lit it, placed it on a hot brick, and then put the hot brick in a bucket, and you had to sit over this bucket to like that treat hemorrhoids. They say it cured them. Before going to the doctor, they Google everything, read all the symptoms. And again, they read that it could be cancer, and that's what prompts them to see a doctor more quickly.
Myths, actually. There are many of them on the internet, and they are not always related to folk medicine, but rather to the incorrect presentation of medical facts. Because there's a lot of information, and it's not composed by medical professionals. A person reads all these things, absorbs a mass of terms that they are unable to interpret. Therefore, I generally have a negative attitude towards people reading and trying to diagnose themselves before visiting a doctor.
What problems do people come to you with?
Well, most often it's probably hemorrhoids, followed by anal fissures, and the rest are intestinal issues, constipation. They ask how to live correctly, how to eat, how to avoid constipation. Sometimes people come with a history of constipation for 15-20 years, and that's how they've lived their entire lives, suffering. Very often, we have to help such people.
Proctological problems are mainly related to tension. People experience tension at work, some physical strain, heavy physical loads for some, or intellectual stress. This affects their immune system and the functioning of the gastrointestinal tract, leading to various dysfunctions, digestive disorders.
Most dangerous, of course, is bleeding. Again, if we consider oncology, there will be no pain. The first sign is the discharge of blood and mucus from the rectum, both during defecation and outside of it.
Is anal sex safe?
I was expecting this question. It's probably the most critical one. Honestly, nature didn't design this organ for intercourse. I would not recommend it. In terms of proctology, people who engage in anal sex often have incontinence, so-called insufficiency of the rectal sphincter. They may not be able to hold gases and, subsequently, may not be able to hold stool, which of course will bother them. But they cannot give up this habit, or whatever it is. And this main question, which a couple must ask each other, is whether they got bored, or if something is wrong, or if they are not feeling right. You see, it's a reason to figure out whether the relationship is okay or not.
In my office, I only encounter the negative manifestations of this process. The rest is, let's say, a personal matter for each person. They decide for themselves how much they need it, how much they want it, and they take responsibility for their behavior and the risks involved. Let's say I haven't encountered positive manifestations of this process because people don't come with those. They come with problems following it.
What is your most memorable case from your work experience?
Probably the most common joke is when patients ask to take home the disposable underwear they wear at my office. Some even leave wearing it, which is so funny. Although my nurse and I have somewhat gotten used to it. It's unclear why they need it, whether they'll brag about it somewhere or go to a sauna. Well, probably that's the funniest thing that happens almost every month. Proctologists deal with extracting different from the rectum. People insert all sorts of things in there. For me, this is somewhat unusual. I've seen various objects extracted from that area. Recently, I spent 40 minutes removing an electric toothbrush. Imagine, it was inserted handle down, very deep. The handle just prevented the brush from coming out. 40 minutes I spent extracting this object from the rectum without any anesthesia. The patient was very overweight, about 150 kilograms. Even my finger turned blue, almost black from the strain. I stretched it, injured it, but managed to remove it successfully.
During my work, while being 8 months pregnant with a noticeable belly, I had to operate on a patient who was at the same stage of pregnancy. It probably looked strange from the outside, as one pregnant woman helped another.
What is your typical patient like?
My patients range from 16 to 90, 95 years old. I had such elderly patients. An absolutely coherent old man came to me finally with his hemorrhoids that had been bothering him for 40 years. Most are people with sedentary jobs. Currently, there's a peak of IT specialists. They are accountants, bank workers, of course, drivers. Both men and women are equally common. Nowadays, many athletes who visit gyms are coming to me. A sudden load, and here you go. Hello, Dr. Proctologist. Besides, there's a widespread obsession with fast food, which certainly doesn't lead to a healthy functioning intestine.
How do you help the patient to relax?
The most important thing is the contact with the patient, eye to eye. When the patient feels that this is their right doctor, their anxieties go away, and they trust, because trust is the foundation of a quality consultation, and most importantly, the basis of recovery. I always explain what they are about to experience. It's essential to tell them it's not painful, at most, uncomfortable. Such dialogue should be maintained throughout the consultation. Then the patient trusts me, relaxes, and tolerates these examinations quite well. There were a couple of cases with particularly excitable individuals who are terrified of even being touched. Then they start to act hysterically, behave inappropriately. Nonetheless, eventually I managed to perform the examination. Maybe not the first time, but definitely the second or third.
There were cases when patients decided not to go through with the examination. Seeing the setting, though it's not scary, they realized they couldn't, in some way, react negatively to it, because it's everyone's right. Still, when a person has a real problem and it manifests as a specific illness, they eventually agree to the examination. They can never fully relax until the end. It's probably only after the examination that they start to feel a bit easier. Then people are able to think more rationally. One of the most common phrases I hear in my office is, "It turns out it wasn't as scary as I imagined."
Is colonoscopy painful?
Colonoscopy is when the large intestine is examined from the inside using a flexible probe with a video camera. Some patients say it's painful. It's not a problem to do it under general anesthesia to make the examination comfortable, but some, especially those with a low pain threshold, can try it without anesthesia. It's said to be less risky for damaging the large intestine because the patient can immediately say when it hurts, and the doctor understands that the instrument might be going in the wrong direction.
50, 55 years. These are the ages when anyone, even without complaints, should consider checking their large intestine, so if any polyps are found, they can be removed.
Do patients faint?
It often happens, especially after some surgical interventions, and probably 90% are men. Women are physiologically prepared for blood loss, maybe childbirth. Men, a small scratch, and they're fainting, like it's nothing serious, but they're gone, smelling salts. On the couch, measuring blood pressure. No, I haven't had such cases, and God forbid it happens. Generally, people are afraid. People are afraid of everything, and that includes proctologists. They are afraid of dentists, proctologists. Well, they say a proctologist is even worse than a dentist. Firstly, it's a very intimate area, and secondly, they don't know what to expect. They always ask, "Doctor, what will you do to me? What will you put together? Will you look inside me?" And some people want even the construction of these machines explained to them in great detail. How deep will you, frankly speaking, insert it?
Most often it's due to the history. Before the visit, the person is fasting, they are nervous, so they may initially have low blood pressure plus elements of stress. Essentially, what is spun in their head. Everything is fine during the examination. When it's all over, some relaxation occurs. That's when it can happen, but it's not new to us. We respond to it adequately and calmly. In general, we bring them back to their senses.
How do people around you react to your job?
Generally, I approach it with humor, although I won't hide that some are surprised. Sometimes unfamiliar people at someone's house ask me to go to another room because they have pain and need help. Honestly, people react with understanding, of course. The profession is specific, requiring heightened attention because patients are always nervous and embarrassed when they come for a consultation. Therefore, an individual approach is needed for each patient because everyone is different and wants a more delicate handling. It's just like any other job, like any medical specialty.
The profession of a doctor has always been respected. I haven't yet, thankfully, encountered any negative responses or reactions. Acquaintances and close people, of course, come to me because it's easier for them. If they have any problems, who will they go to? Of course to me. Why go to a stranger? Much of our work depends on trust.
Do you often have patients come to you for preventative care?
Probably only 1% of all patients come for preventive checkups, very rarely. Sometimes it happens that wives literally bring their husbands by the hand and sit together while I examine the husband, and the wife sits, making sure everything is all right with her spouse.
There are conscious people who understand the need for a checkup. Even in the absence of symptoms, it's better to have a real preventive examination. I think that after 30 or 35 years, even if there are no complaints, it's better to get checked.
How do you protect yourself from hemorrhoids?
As I tell my students, people are divided into two categories, those who have hemorrhoids and those who will have them. It's very rare during medical examinations that I don't find at least first-stage hemorrhoids. Proper nutrition, food rich in plant fiber, timely bathroom habits, once a day, ideally twice a day, morning and evening. It involves avoiding serious physical strains. What you rarely read on the internet is avoiding stress. Hemorrhoids are indeed a disease of civilization, either due to chronically experienced stress or acute stress. Where a person's sense of safety, financial and material stability, and feeling of protection are disrupted, there's a risk of this problem arising. Maintaining a healthy lifestyle is essential, including proper nutrition to avoid constipation and diarrhea. Every hour of sitting should be interrupted by at least 5 minutes of walking to stretch the area and stimulate blood circulation. The key is to avoid constipation. If a person suffers from constipation, in almost 100% of cases, they will have hemorrhoids at some stage.
If a person engages in physical exercise and sports, but without excessive strain, and if their diet is time-oriented, meaning not overeating at night, and if they go to the toilet in time, not suppressing the urge due to the inability to visit the bathroom in time, and if they observe their body and try to follow these well-known general principles, then they usually don't face problems.